Welcome, everyone. Like to talk tonight about therapeutic approaches and different therapies and approaches that we do when someone is coming in for or desiring some sort of help with their problems in living, a neurosis, a psychosis. What do we do on the side from the psychologist's point of view? How do we treat whatever it is that's coming in? Well, remember we talked first about our psychological model, this castle that we can't see inside. That's the mind. And we have to figure out a way to figure out what's going on inside there and then deal with that. And we can only see what comes out when the castle door opens. So we're not always able to do the right thing because we don't always see what is really going on inside the castle. But we deal with the things that come out, and we hope that that does a fairly good job of helping that person to live their life a little bit better and without the problems that they might have. Okay. Welcome everyone that comes in. Okay, someone is already saying there's a rare parasomnia that is better than most. Okay, he can have sex in his sleep. It hasn't happened in a while, but it was fun when it did. Well, yeah, as Poxy points out, if you can walk and talk and actually eat in your sleep and talk, have conversations, full-on conversations in your sleep, I don't really see that it would be impossible. I think that's probably something that happens to more people than they would believe, actually. Yeah. I would feel that happens more often than people might even know about. As long as it doesn't bother you or the partner, it's not a real problem that would cause you any concern. If it were with the partner wasn't very happy about it, then that would bring up concerns. Okay, yeah, like I said, you never know until something walks out of the castle. The person in front of you, patient, client, whatever you want to call them, says, this is what's happening. You can't deal with it until you come out with it. So, good. I don't think there's been too much time when, yes, it would be rare. I don't think there's been too much time in our history where we've actually blamed a person who's got some problems. Okay. I don't think we really blamed them for them too much until very recently, in some instances. Even in the back history, way back, we knew that this usually was something a person couldn't help. And so the blame has not gone on that person. It might have been demons or something like that. They may have said, they're possessed. They may have thought, well, they've got some sort of physical disease that is causing this. They might be blamed if it's related to like alcohol or drugs. They might say, yeah, your problems are due to your drinking. You need to stop that. But most of the time, people have been pretty understanding that ailments in the psychological realm are usually not the fault of the person. Although some people are harder to deal with in that regard. Like, let's say a person with narcissism, you might think, gosh, they're full of themselves. And so you might take it too personally. The That's one of the things therapists learn not to do, is to take things too personally. If someone comes in and they're saying things to me, I'm like, okay, let's talk about that. Why do you feel that way? But I'm not going to take it personally, because if I do, I become part of the problem in a way. Most of the time then, therapists have been aloof. Now, hello, Don. Some of the therapies or approaches have not been very kind, though, even though we're not blaming these people. You see a person come in and you're like, oh my gosh, this person's out of control. Let's confine them somehow. And after a while in our history, we figured out that, people with psychological problems that are tied to a wall don't get better that way. It's not. Science is slow sometimes, and it takes a while to get there. So, the idea of a hospital like Bedlam in London where, people were chained to the wall, those conditions eventually improved. There were a lot of social factors involved with that, but also the scientific fact that people weren't getting better. They may get worse. So, okay, we can't do that anymore. For a while, they did surgeries like lobotomies to try to cure different ailments. When I say lobotomies, they weren't always this picture that we have as modern people of you going into the surgical suite and they're giving you anesthesia and cutting. No, they would take an ice pick, and I won't go into detail because it grosses me out. Anyway, we've moved on from that. They moved on to a cleaner surgery. We figured that was not helping a lot of people, and it was causing a lot more other problems the person didn't have before. So, unless it's a brain tumor, we shy away from trying to do any kind of surgery right now on the brain. Tumors maybe release fluid that's building up on the brain, but operating on the brain itself, not so much. Someone, in the hoopla of electricity, thought maybe we could shock people out of this. And in the grand tradition of experiments, they did try to shock people. And, for a while afterwards, it seemed to help in some instances. Well, maybe it was because the person was shocked and electrified and nearly electrocuted, and, it scrambles your brain for a while. It's not like, you do with a computer where you turn it off and then turn it back on. The brain doesn't quite respond to that. So they found that in the long term, that doesn't quite work so well. Plus, it just seems cruel to us now. But it is still sometimes used in really difficult cases. If a person has a violent psychosis, say, which, like I say, is fairly rare. But, for a while they tried shock therapy using insulin. They would not electrify you. They would give the person a shot of insulin, and the insulin shock would kind of restart you. But they found that even that was not very effective in the long run. So somewhere along here, Sigmund Freud comes along. Now, Sigmund Freud he had a lot of stuff not quite right. Because in his case, the things that came out of the castle, okay, like I say, we're throwing stones in the castle and seeing who comes out and what comes out. And in his Victorian era, everyone was repressed, and sex was not something you talked about. So in the therapy session, when, you've got a person here who's saying, I'm not going to be judgmental at all, maybe they felt, okay, maybe I can finally talk about this. So they would talk about their sexual problems, which for his clients, that was probably the number one problem they had. So his therapeutic and theoretical background came out of his customers and his environment. In each case that we're going to talk about, these folks are going to somewhat drive the theory. They're going to drive the therapy, and so is the therapist. Okay, their theory is going to come out of them as well. So we know Freud probably had some repressions and such. We've got some chat here. Exposure therapy. Oh, we're going to talk about that too. Yes, that comes up as well. But Freud, for all the things he didn't get quite right as far as we know now, he did one thing that was great. He gave us an alternative to doing things to people physically, okay? There is still drug therapy, and that's very helpful for people who have issues that are much more difficult, people with a psychosis, people with a mood disorder. Drug therapy, pharmaceuticals can help a lot, okay? But Freud kind of got us back into that philosophical, let's talk to the person before we do anything kind of idea. And so for that, hats off to Sigmund, because he really helped us out in that regard. Carl Jung was a student of Freud. He didn't agree with everything. He branched off in a different way. Other people branched off from there. And then now we've got all kinds of therapies going on. And but Sigmund opened up that idea that, let's talk to the person, see what's going on. Okay? So then we got into talk therapy. So what I want to show you here is a little chart that I got when I was in school. So this has been a long time ago. And I don't know if you can read all those or not. So I'm going to read that off as we go along. So excuse me if I look down to my notes. But this little chart has helped me to understand what the difference is between all these different kinds of therapies that we're using today. Okay? Talking about sex and dreams and having sex while sleeping. Yeah. That can also happen too. I'm thinking what you're talking about is you are asleep and then have sex and you continue sleeping through the sex. I've known people who have fallen asleep during sex and then woke up again and maybe fell back to sleep. Male and female, by the way. I'm not casting aspersions on anybody. And that can happen in instances where a person's very tired. Okay? Sex is very important. And, sometimes if you can't do it while you're awake, hey, So that's one also the thing we had to thank Freud for is getting the whole talk of sex out there where we can even talk about it now and not be, ashamed of ourselves. So let's talk first about the psychoanalytic or Freudian, although it's not always Freudian, but the psychoanalytic therapy. Now, there's some assumptions to each of these therapies. And I'm going to go through the assumptions, the therapy itself, and how the therapist is supposed to behave during that, okay? And I'll add things on at my own. One of the things you'll notice in each of these, though, that are different is the assumption of free will. Does the person have free will or not? And whether the therapist, how involved the therapist is, okay? Because some of them, they're going to be sitting in the back. Some of them, they're going to be very active, okay? In psychoanalytic theory, the assumption is that man has no free will. Basically, you are the product of your past. Freud once said that the child is the father of the man, meaning that as you're a child, you develop into what you're going to be. And so he based a lot of things on childhood experience. Your behavior is determined by your biology and your environment. He thought neurosis stemmed from repressed childhood memories and conflicts that you had as a child. Whether, and I say conflicts, they may not have been outward conflicts or conflicts that anybody else was aware of, but they were conflicts inside you that you had with the outside world. The therapy would be somewhat directive, but not too directive. In all these and most of these therapies, I should say, not all. Most of these therapies, we're trying to get the patient or the customer to realize something for themselves. And so we may be directive. We may say, hey, look at this over here. What does that mean to you? But we're not going to tell them exactly what it is that we think it is, because we might be tainting the thing. If you jump in immediately and say, oh, yeah, you loved your mother, and, oh, my gosh, if that's not right, your whole therapeutic environment, your whole rapport with that person is destroyed because they say, well, what the hell? What are you coming off with? So we don't want to really come out and be too directive, but we want to direct the attention of the client to certain things. The therapy is very much in psychoanalytic is diagnosis of the past experience, which is very important. The past is everything in this therapy. It's very verbal. They will look for transference. Now, transference is when the patient will transfer certain feelings to the therapist. So, in an example that I'll share, someone might look at the therapist as a father figure, or uncle, or I think that's how I got the term Uncle Carl. Someone felt that way. Or they may have a romantic feeling towards a therapist. And so we encourage those to occur in psychoanalytic therapy because we want to see which one comes up, and then we will deal with it. Like I say, we got to wait until the person comes out of the castle before we can see what the problem is. And so transference is a kind of a secret way of kind of coming out of the castle disguised, or you're trying to disguise the therapist a little bit. And that's very telling of what you're feeling. So that's kind of something they want to get out. The therapist in a psychoanalytic setting is going to be very neutral, benign, non-judgmental. Freud had the habit of putting the person on a couch and then sitting kind of behind them out of the sight where they couldn't see. Maybe because he was making notes, but also because he didn't want them to see if he made a facial expression. Okay? If he went, that's kind of going to put a person off from sharing anymore. So he thought that it was very important that he was neutral and would say, go on, tell me more. and get the person to come out. He would try to interpret any kind of resistance to the therapy as the subconscious mind fighting back. And I have seen this before too. Sometimes there is a resistance where the person will share something and then pull back. And Freud saw it as maybe, some sort of unconscious sort of thing. I see it in another way, and we'll get to that in a bit. But yeah, he was always trying to get the unconscious things to come up. And I would say more subconscious things. We'll get to that. Okay, another therapy that has come along that in this talk therapy sort of thing, I'll put this away for right now. Sorry, playing with my notes. Client-centered therapy is the second one on this list that I showed you. And client-centered therapy from Carl Rogers, he was the one who kind of came up with this. He felt that man has free will. Okay? You have free will, and your behavior is determined internally. There's something inside you that determines how you act. Sounds reasonable. He thought neuroses came from some sort of incongruence or argument between what your self-concept was and what happens out in the environment. So if you had this thought about yourself, but the environment did something else and didn't react right to that, you could develop a neurosis from that sort of thing. Which I can see, because we all hope that when we say something or do something, it will have a particular response from other people. And if we don't get that response, we start to think, whoa, what's wrong with them? Or what's wrong with me? What's going on? Okay. Trey, I really need to see my therapist. Otherwise, I'm going to feel like I'm talking to myself and stop talking. You mean now in this setting? Because I don't want anybody to shut down and feel badly for what I'm talking about. So please let me know if I'm causing you any troubles. Okay. In his therapy, Rogers is client-centered therapy. So he's going to be non-directive. He's going to let you talk about whatever you want to talk about. Whatever comes up is what we'll do. He would try to like to try to focus on the here and now. Okay. Okay, good. Thank you, Trey. I appreciate that. You're feeling okay. Yeah, let's talk about the here and now. How you feeling today. Let's not go down into your childhood. We don't need to do that. We need to... Oh, okay. I see what you're saying. Yeah. If the person sat behind you, you'd feel like you were talking to yourself. Yeah. Yeah. I would have a problem with Freudian psychotherapy as well, because I would feel like am I getting anything out of you? And you'd love this particular type of therapy, Trey, because it's very verbal, and the relationship is very important. I'm going to share something later which talks about that. But he's thinking, yeah, the therapist has to be involved. Okay. Now, not directive though. He's non-directive. In fact, in the thing I'm going to share, in fact, I'll just share that now. It's still in my... Yes, good. Okay. What I'm sharing there is a link to a YouTube video that goes through a lady who went through three different types of therapy, the three that we're going to talk about tonight. And the first one is with Carl Rogers, who developed this therapy. And at the end of it, he discusses her case, and he's like, I was really involved with her. I really was my true self. She began to show her true self. I think this could work, and I'm really sorry that I can't work with her more. He developed a relationship with her in that regard, a therapeutic relationship, but it's still a relationship. And each of these three therapies that she went through, and she allowed them to be videotaped, or filmed. They're in black and white, folks. So be aware. But Gloria, who went through these, she, at the end, if this is like the one I saw way back in the day, oh my gosh, like I say, it was in black and white. She rates how she liked the therapies, okay? And so it was useful to her in some regards. And I hope that she followed up on one of them. Whichever one she would like to choose. You'll have to watch the video to find out. I'm going to be... But anyway, this client-centered therapy, the therapist has to be very honest and empathic, non-judgmental, even to the point of the fact that Gloria was very frustrated with Rogers because she wanted to have him tell her that her sexual relationships were okay, the ones that she was having at the time. And he was like, well, that would be telling you, and I'm not going to tell you. You need to decide that for yourself. And a lot of people will almost poo-poo Rogers' therapy. They will say, well, he's just saying, well, what I hear you say is, and then repeating back to her. Or things like, well, I can't tell you. How do you feel about that? And yeah, he does that, but not in those words so much, and that he does more than that, okay? So watching this, again, as I was watching it before this show started, made me feel like, okay, yeah, a lot of people have really shoved Rogers in a box and said that's all he does. No, he had a great therapeutic way with people, and they really felt heard. But many people, like Gloria, would like somebody to tell her what to do or tell her that's okay. And Rogers would not do that. And it frustrated her a little bit. Okay? Okay, you have a friend who's a therapist. Okay, good. If a therapist, even as a friend, says, have you ever noticed how you... And you go, whoa, okay, didn't know that before. Note accepted. Okay, gotcha. And that is... The next point is very good thesis. You say when you're, feeling badly, so you stop shaving. Okay, good to know. I've had an experience, and I'll tell you about this. I had a customer that Donna could tell if I had that customer during the day. I would have to wash it all over because Donna has allergies to perfumes. This lady felt very badly, very low point in her life, and she would come into each session smelling like she bathed in perfume, okay? She did that to feel better about herself. as we progressed and as she got along better and as things got better in her life, I noticed that that perfume would peter off. She would use less and less until, at the time when we weren't seeing each other anymore, when I considered that, hey, there's nothing more I can do for you. You've done so much for yourself. I don't think you need to see me anymore. She was wearing very light perfume. So that can be a sign. People will either will stop doing certain things or they'll start doing certain things. And as things get better, they will change how that thing is. And it's a good way to tell physically what's happening. Okay? Okay, yeah, very good thesis. In this next therapy, Gestalt, something like that would be noticed right away, because Gestalt is it's a strange sort of therapy. Not a whole lot of people do it anymore or do it in the way that it's portrayed a lot of times or that it was done. Gestalt is trying to get, Gestalt means the whole, okay? It's like a holistic sort of thing. It's basically when you have problems, it's because you have split inside a bit. You might have a real self, and you might have this fake self that you use a lot of times. And there's a lot of game playing going on in your life, and you're not being real. And he's very directive. Fritz Perls, or Frederick Perls, he went by Fritz. He liked that better. Perls, Perls. And he's in these videos. He's the second one that Gloria sees. But he's very directive on things. He will look at the here and now, not the past. He doesn't care childhood. In fact, you bring up childhood stuff, he's like, no, what are you now? In the video, Gloria says something about she wants to hide in the corner. And he says, well, like a 3-year-old or something. Yeah. Well, how old are you? She's like, well, I'm 30. Okay, you're 30 and you want to go hide in the corner. See, he's bringing it back to her now. He didn't want to talk about, what she was doing in childhood. He wanted to know, how are you feeling now? You want to hide in the corner now as a 30-year-old woman? She's like, well, no, but I feel like I'm being put in the corner. So, okay, he's got her back to the here and now. He's very aware of body movements. So when someone is doing something like they're tapping their foot, or like me, I'm stroking my beard all the time, that would be something that he would call out and say, okay, just do that again. Do that again. Do it again. And make you aware of what you're doing. Gestalt is very honest. Okay, I mean, if a Gestalt therapist sees you doing something and they say, you're being fake, they'll point that out. Okay, masking is another way of saying that. Yeah, in the video they say you're being a phony, so you can tell this was made in the 60s. That was a big thing. Don't be phony, man. He's very confrontive to the person. And you can see that with Gloria. He's very confrontive to her. If she says something, he's like right on top of it. And she's like, you're attacking me, And he's like, well, tell me to back off. Well, back off. No, tell me. Really tell me. He's confrontive and making her be confrontive. Trying to get her to grow up from her, hiding in the corner. And he's very good at pointing out the games. There was a book, I think Eric Byrne was the gentleman that wrote it, called Games People Play, very much in the Gestalt realm. He named the games. He had all kinds of games like this person is playing Little Red Riding Hood game. Okay, it's been a long time since I've read the book, but he had a lot of games that people play, and he would bring those out in the therapy session and say, "Okay, do you see what game you're playing now?" And Gloria in the films does have some little games she plays. And she was called out on it by the Gestalt therapist. Okay, the next therapy we will talk about, behavioral therapy. Pardon me. Well, there's a lot of pollen in the air, and I've got sinus issues. So please excuse me. Everyone hydrate. Behavioral therapists might believe that man has no free will. Basically, okay. Are you talking about Gestalt, Foxy? You don't think that would work for you? And Trey? For some people, it's great. For most people, they would probably feel a little bit put on. It can help a lot of people, but you have to feel safe in the environment. Okay. You'll notice that he makes a big deal about her being safe. Like when she says, "You're going to attack me," he says, "What would I do?" And she's like, "Oh, I don't know." And it's like, "Okay, well, let me know if you feel unsafe." He kind of says that in so many words. Behavioral therapists, though, they don't think you have free will. They think the behavior is caused by your environment, and it's all shaped by consequences that have happened as you grew up in your environment. You are a product of the world. And your neurosis comes from when you've learned something, but you've learned it in a very maladaptive way. So it's not something that's going to help you to grow as a person. It's not something that's going to help you biologically to, meet people and procreate and continue the species. I think behaviorism would fit very well in the Darwinian system, somewhat, in that respect. Behaviorists are very directive. They will be like, "Okay, this is what we need to do." Okay. They will look at your present behavior, and they will look at the reinforcement of that. Maybe, when did you start being afraid of thunderstorms? Okay. And has this been going on? How long has this been going on? Because that will tell them how long they might have to do on therapy. They're going to be verbal, but they're also going to have activities for you to do. They're going to be very analytical, and they're going to use their therapy session to condition your behavior, to teach you to behave in a way that will be more adaptive. They're going to be analytical. The therapist, these are the behaviors the therapist has to do. Analytical and objective, observational, evaluative, okay? So they're going to evaluate what you're doing, okay? Because to call something maladaptive, you're somewhat making a judgment call. So they might use some judgmental type of things, like, okay, what you're doing is hurting you. Okay? So we're going to help you stop that. And this is the first therapy that we'll talk about that has explicit contracts with the person. So you might, let's say you're afraid of thunderstorms. Okay? He might give you an exercise to do the next time there's a thunderstorm. And you will have to sign the contract saying, "Yes, doctor, I will do that exercise next time there's a thunderstorm." Okay? So they are going to be very directive in that therapy. Okay, yeah, you were talking about the Gestalt therapy. Yeah. Sometimes, okay. Now this is gonna ruffle feathers. Because I noticed it in the Gloria sessions. Sometimes the therapy that you like the least could actually be more helpful than therapy you like the most. Okay? That doesn't sound very nice as a therapist, but sometimes people need confronted in certain things. And so maybe you might want to give that a try sometime. And the next one is also a confrontive therapy. It's cognitive behavioral therapy. Okay? In behavioral therapy and cognitive behavioral therapy, you might also have some exposure therapy, like if you have phobias. So, in behavioral therapy, if you say, I'm afraid of snakes, snakes, can't even think about snakes, they will develop like a 12-step program for you. Okay, I want you just to think of a snake in your head for 10 seconds. Okay. Then they might say, look, I'm going to show you a still picture of a snake. It's not going to be moving. It's just going to be like a photograph. And I'm going to put it on the wall over there. I want you to look at it for 10 seconds until, you can accept it and look at it and not be uncomfortable. Then I want you to hold the photograph at arm's length here and look at the photograph for 10 seconds until, we'll keep doing that for several sessions until you can hold the photo and not be appalled and scared. You're just saying, oh, okay. It's almost pretty. It's not pretty, but okay, I can see it's not as bad as I thought, Okay, can I show you a videotape of a snake just out somewhere? We'll say it's Wyoming, okay? It's far away from you. Here's a snake in Wyoming, okay? And when you can watch the video and not feel fear, great. Next, we're going to go to a pet store that there are live snakes here. We're not going to go over to them, though. We're going to go look at the birds. But just know that there are live snakes in this store. They're in a cage. They cannot get out. But, when you feel comfortable with that, knowing that, and you don't want to just run out of the store immediately, then we'll say, okay, the snakes are over on that wall. Can you look at them from across the room? This exposure gets closer and closer until eventually you're able to pat a snake and say, you know what? It feels pretty nice. That's smooth. Ooh, I thought they'd be all slimy. No, they feel like leather. Oh, wow. Cool. And, that will also be used in cognitive behavioral therapy too, somewhat. Okay? But we're not going to, in cognitive behavioral therapy, we're not going to assume that you don't have free will. We assume you have free will. We assume that your behavior is determined by logical thinking and responsibility. Okay? If you have a neurosis, it's from irrational thinking and irresponsible choices. Okay? The thinking is very important in this. Okay? So I don't just make you look at pictures of snakes and get them closer to you. I'm like, what's the problem with the snake? What's going on? Why are you afraid of the snake? The behaviorist is going to ask you why, but they don't really care except for how it does the therapy. The cognitive behavioral therapist will want to know, what is your thinking about the snakes? Why do you dislike them so much? if that makes sense. It's a very minute difference, but it is a difference. Therapy is very directive, again, okay? It's going to confront a little bit about what the present behavior is, okay? What are you thinking about it? And what values are important to you, and why that difference causes you problems. And it's going to be a very involved relationship, okay? The therapist is going to be involved, but they might sometimes be a little bit judgmental, okay? And they're going to, if you start thinking illogical thoughts, they're going to bring that up. Say, hey, that's not good. Why are you thinking that way? And they will also have some sort of contract with you. It may not be written, but that's going to be one of the things that they will go into. Part of cognitive behavioral therapy is one of my favorite subcategories is called rational emotive therapy. Okay, and a rational emotive therapy by Albert Ellis, also in the video that I shared. I think he's the third one she sees. Albert Ellis, he was a wild character, okay? But let's say that a person comes in and they say, my spouse told me I'm fat. And I'm very sad about that. And I'm very down on myself about that. And Ellis would say, well, the fact that your spouse said you were fat didn't make you feel badly. And huh? Well, yes, it did. No. There's a judgment in there that you are putting in that basically it's A, B, C. There's an activating event. There's a belief in the middle, and there's a consequence. And the activating event, hey, honey, you're getting a little chubby there. The belief is chubby is not good. And that maybe, this person's opinion, matters a lot, or maybe they're right. And then the consequence is the emotion. Okay? And it's the thinking in the middle, that belief, as Ellis called it, stinking thinking, that often is the problem. Now, if it's somebody you care about a lot, like a spouse, then you might say, okay, I might have to do something about this. But if like some guy across the street says, hey, fatty girl, excuse me, the belief is that that person doesn't know what they're talking about. Okay, or they don't know how to appreciate a real woman. Or maybe they've got some problem of their own. I'm not going to feel bad that they called me fatty girl because I don't think they know me, the real me. So that belief can mean a lot to how a person acts or reacts. Okay, we've got some more chat here. Dawn says when we go to PetSmart, she'll go over to the snake enclosures and talk to them. Very good. You're scared, but you're facing it. That is the way you're doing your own exposure therapy there. Pardon me again. Which is very good. Okay. And Foxy, you are the snake handler, huh? Okay. I think I get that because you are the... Foxy, for those who watch this later, Foxy is a Disney princess. She can talk all kinds of animals and everything. And I can see her taking the snake out and saving it. Yeah. If you have an allergy or something like that, it's different, so that's something you have to be aware of. Okay, Thesis is going to share. He's had some problems with snakes ever since he can remember. Oh my gosh, reptile world. Okay. Yeah, there's another therapy that goes in with exposure therapy that's not the gradual type. It's like, oh, you're scared of snakes? Let's go to reptile world. And they throw you in the deep end, so to speak. That may teach you how to swim or you may drown. And a lot of people will have a very adverse reaction to that. And it may make the fear worse. Okay? Oh, a room you had to walk through snakes hanging from trees. Oh. No, that I would not consider that a good therapy. Torture method, maybe, but I don't think that would be a good therapy at all. The fact that you did it, though, was very good. Yeah. Yeah, if you have fears, I prefer using the gradual approach, and I recommend that, because I don't really think that flooding the person, that's what that's called in our parlance. We would call that a flooding event. We would flood the person with the fear, hoping is the thing, that it would flood all your emotions at once, and then you'd reset, like I say, you turning the computer off and then back on. But I don't think the brain works that way very well. For some people, it might. They might say, you know what? There's nothing worse than walking through a room with snakes hanging off of trees and things over my head. I lived through that. I can take that garter snake out and put it back outdoors. Okay, I've lived through the worst. But many people won't. It will make the fear deeper. So I don't usually recommend that. Okay, Donna has aversion to bridges. I like how you guys are sharing tonight. That's great. As a physical reaction to the sound of the bridge, reacting with her tinnitus. That makes a lot of sense, really. A lot of times with the fears, and this is why we're using this very gradual approach, it's not only the seeing the thing, okay? It's thinking about seeing the thing. It's about thinking about how you felt the last time that happened and the terror that comes from inside, basically. I think that's really what they meant when they said the hero dies, or the coward dies 1,000 deaths, the brave man only one, is that not that you're a coward if you have a phobia, but that fear makes you feel like you're going to die. And you see it like that. And so the person who is scared could die 1,000 times in their lifetime because of that fear coming back. Okay? I think that's what they meant when they said that. Yeah. No, shoving anything in somebody's face is not gonna help. Sorry to say, it's not. Like I say, we work up to this gradually because what you want to do is you want to instill in the person the calmness from the easy things. And then you work a little more. And you get to where if you can calmly look at the picture from 40 feet away, great, good. If you can calmly look at the picture that you're holding in your hands, good. Okay. But you've got to get, at each step, you've got to get to that calmness while you're doing it before we go to the next step. We don't immediately take the person in and throw them in with the snakes. That's not good. Oh, okay. Dawn was going to share a story, but it's too long to type out. Well, okay. You can tell us sometime when we chat live. Crowds, yes. Dan, I saw something the other day. There's the introverts and the extroverts. You've heard of these terms. We've talked about them here. This person called an otrovert. Otro for other in Spanish. The therapist, I think, was from Spain. And he called a person an otrovert, meaning a person that likes one-on-one with individuals. They don't mind going outside the house and talking one-to-one with a person. They're not a total loner, but when they get in a crowd and there's no defined roles for people to play, then they get nervous. Like if you go to a doctor's office, okay, you see the nurse, okay, you have an interaction, okay, good. You go to sit down. There's other people sitting out there. They are in a patient role like you are. You're going to see the doctor. The doctor is in a doctor role, and you're in a patient role, and you're okay with that. You know, it as long as everybody has these rules and roles, everything's cool. At a convention, weird things happen. Weird people talk to you. Sometimes weirder than others. Odd things can happen, and that would put the otrovert or the introvert into a little bit of panic. Like, whoa, I didn't sign up for this. Thank you. So I just found that interesting. The otrovert. It's you're not really totally loner. You're not that life of the party, but you're okay with one-on-ones. Yeah. Okay, thesis, very good. That yeah. Bring up her fear and maybe she'll be a little bit more considerate next time. I hope. Mm-hmm. Yeah. Okay, good. One of the things that in the Gloria movies that I've shared, one of the things that of all people, Carl Rogers says to Gloria, and I thought, this is interesting. He says, it's a very dangerous thing to do, to live. And she's just kind of like, okay. But yeah, life is dangerous. I mean, you know, things happen. People happen. Situations happen. You don't like them. So those kind of things can be uncomfortable for us. And we hope that through therapy that we can help a person be more comfortable with their life and be able to get around things. Now that I've said this and I've shown all these different types of therapy, I want to show you one more thing here. The types of therapy. Only 2% of all therapists identify completely with one type of therapy. They'll never use anything else. They swear by that one type of therapy. Only 2%. So the rest of these numbers are not going to add up. Okay? Because everybody else uses multiple techniques. 79% use cognitive behavioral therapy nowadays. 41% include mindfulness, which is a newer type of thing. It's, okay, cool. Be mindful. 36% use some sort of psychodynamic or psychoanalytic therapy. So they're using Freud or Jung in some regard. Maybe they're not saying, the problem's your superego, but they might use some of the techniques that Freud used to get his customers to talk. So, and 31% are going to use Carl Rogers client-centered therapy. So those numbers won't add up because most therapists are what we nowadays call eclectic. We borrow from this to that to this to that. So I mostly used gotta remember I'm retired. I mostly used cognitive behavioral type things, but I would start out with a client-centered therapy to get the relationship going, okay? And then I would get more directive as I got to know the person, and I knew, okay, I'm not going to scare this person off. They're going to come back, and so I'll get more directive as we go. If they needed some sort of, desensitization or exposure therapy, okay, we'll work into that eventually. So yeah, I would pick and use what was most needed for each person. For people who would need medications, I would say, are you taking medication? No. Okay, for this particular type of issue, you might want to see a doctor about that. Maybe even a psychiatrist. Get some medication, and then we'll continue on with the rest of this therapy. So, yeah, eclectic is the word. Okay, we're still talking about being in crowds. Yes. Okay. Foxy says that she can handle the mindfulness much more better than the cognitive behavioral. Yeah, I could see that. The length of therapies are going to differ. Okay. Psychoanalysis, the psychoanalytic method, takes years because you got to dredge up every childhood memory and deal with it and blah, blah, blah. Gestalt might be a faster one. Behavioral type therapies will be the fastest, perhaps. Cognitive behavioral therapy and client-centered therapy going to be about the same. Shouldn't last more than a couple years, usually. If it goes on beyond that, there could be other issues to be dealt with. And sometimes it's on the therapist side. Some people have a hard time letting go, even of, a person when they're dealing well with their problems and everything's cool. And they might be, well, I want to, they've developed a relationship with that person and maybe a little too much. So, I always liked it when people would come back to the office 2 or 3 years later and tell me how they're doing, or, hey, I got a new job, I got married, whatever, I like that, but I didn't demand it, okay, because I am just the cog in the wheel, They are the ones that do the work. So, we don't want to get too demanding as therapists about those kind of things. Unless it's something you think they need to do to check in. Okay? If we've talked about a phobia or something, and I might say, well, come back in a year or two and tell me how that's going. Okay? All right, folks. We have covered everything that is in 2 of the classes that I used to teach, Intro to Psychology and Abnormal Psychology. It's about all the topics I had. For next week, probably our last, like I say, it's hard to let go after you developed a relationship. For our last session, I want to say what's bothering you, okay? If there's something that you want to talk about I did not cover, and you want to have you have another question that you think of during the week, like, oh, hey, I forgot to ask him about this. We can do that. I also, once a month seeing a therapist for years is a good thing or a bad thing? It can be a good thing. It is, as long as it's helping you and growth is occurring and you don't feel like, oh, this is a ripoff. I haven't learned anything new about myself in a year. Then maybe, it's time to say, are we done here? But if you're still growing, if things are still better, if as long as you're making progress, keep at it. It's fine. I'm just saying that, I wouldn't want to drag it on for a person. From my side, I wouldn't. A psychoanalytic thing could last 8 to 10 years. Freud kept patients for years, but then again, they were rich and he was fine with that. But in the situation I was in, even though people didn't pay for the therapy, they had to come in and use their time. And I wasn't about to waste it by making them stay there till I helped them through every problem that I thought they had. I just want to help them with whatever problem they want help with. And if they come back, if they stop for a while and then they come back later to say, you really helped me with that thing with the snakes, but I got a problem with my spouse now I want to talk to you about. Okay. We're starting anew. It's a new goal. Okay. Then let's do it. Okay. So next time I want to talk about any questions you have, anything that I didn't cover. And I'm thinking about having, and I might, if nobody has any questions, I'll do it next time. But I'm hoping people will have more to say. If not, I want to talk about some weird things that happen in the human mind that haven't really fit any of these. They may not be neurosis or psychosis or anything, mood disorder or anything like that. Some of the topics I'm thinking about are some of the dream issues. Okay, good. EMDR. EMDR is when, and I had a note about that somewhere here. I never can remember what the EDMR stands for, but they will have something like a tapping you will do, or some sort of repetitive motion, or lights. They might flash a light or something like that. And it first time I ever heard about it, I thought, this is bunk. How is this helping the person? You're not even talking about what's bothering them. But scientifically, it seems to be working for a lot of people. So the studies show something. And that's something, I should discuss, I guess, before we leave tonight. I know we're running long. I'm sorry. But remember when we talked about the Hawthorne effect, when people were in the factory and they dimmed the lights a little bit and the people worked faster, and they turned the lights back up and people worked faster, and they turned the lights really bright and people worked faster, and they were like, what's going on? Well, there's an experimental effect there. If somebody knows something is going on, like an experiment, they don't know what you're studying, so they'll do what they think you want them to do. And sometimes any kind of therapy, whatsoever, helps the person because they expect it to help. It's kind of like taking the sugar pill in a way. You expect that to be a real drug. It's going to help you, and all of a sudden, you're fine. Oh, hey, that pill really helps. Yeah, it's a sugar pill. Sorry about that. No, we don't tell people that. Therapy can be, in some respects, that same way. And I suspected for a long time that EDMR was that. Basically, I've been going to this person for several weeks. I had the light flashed in my eyes a couple times. And now I feel much better. And so, is it, if you feel better, good. Any of these therapies, if you feel better afterwards, good. Sometimes just being in with another person that is talking nicely to you, or even talking not so nicely to you, like Dr. Pearls, sometimes even that will make a person realize things and will cause an improvement. And if it does, yay! Anything's good as long as it causes an improvement. Okay? And I can do some more research into that. I just have been thinking to myself, yeah, I like to see more studies. Okay. Like I say, I want to talk about some weird things that happen to people. One of them is the Hat Man. Another thing is liminal spaces. The third man incidents. How people have experienced alien abductions. Okay. Voodoo and deja vu. Those are kind of the weird things that don't fit into any of the other categories, but they all have a psychological effect. And if you can think of others, please write them down and bring them next week, and we'll talk about them as best as I know them. And we'll see, what's causing these weird things to happen, how people reacted to them. Do you need therapy if you saw the Hat Man or not? Okay. So, yeah, deja vu can be very interesting. And there's a new theory out on deja vu. Very timely. So that's what kind of triggered this in my mind. I was like, deja vu. Okay, I haven't brought that up yet. That could be something to put down. And then some other incidents happened, and I'm thinking, there's some things that we could talk about that are just very brief incidents in your life that have a psychological value or an impact. And I think we need to touch on them. So do something like, my favorite case studies. I've thrown some of them in as we've gone, but we could talk about them. Sure. Uh-oh. Thank you, Trey, for you lighting the mood there. That's good. So, anyway, be thinking of those things, please. Write them down if there's some weird topic, or for favorite case studies, if you want to ask about a particular ailment or problem, that would help me determine those. So, and those of you who know me personally, you can Facebook message me and let me know, hey, I want you to talk about this. Okay. So we'll do a couple more weeks and see how that does. But like I say, the therapist should not lengthen the session just for his own benefit. And I don't want to drag this out forever. So I want to thank you very much for coming. And I appreciate it very much. Everyone have a great week. Please watch the Gloria videos. It's an hour and a half, but they're 30, 30, and 30 for the sessions. And it's an eye-opener. And she does talk about sex. So, hey, it's kind of interesting. So please watch Gloria. And if you don't get that link, just Google Gloria Therapy and bunches of stuff comes up for the videos. Okay? All right. So next week, we're talking about your concerns, anything questions about, and or if nobody has anything, we're talking about my list of weird stuff. Okay? Thanks, everybody. Bye. Whoops.